Well, my name is Patti Woolridge. I'm an RN with a Bachelor of Science degree in nursing, trained at Eastern Michigan University, and I graduated in 1986. So I've been a practicing professional for 33 years, and that anniversary is just coming up in April. What I do is, for the last 21 years, I've been practicing what we call biooxidative medicine, and that covers two different therapies. Ozone therapy in medical situations and treating blood with ultraviolet light in medical situations. These therapies can deal with viruses, bacteria, mycoplasma, fungus, and molds in a very different way than antibiotics work. And they are often used with people who have gone through the regular routine traditional medical treatments and can't get anywhere else and don't get resolution with what they're going on. So what we try to do is assist the immune system and the body's own natural defenses to start working again in a way that they haven't been. So we treat blood with ultraviolet light or ozone or both together, and we were able to accomplish a up-regulating or down-regulating of the immune system. Okay, we do a lot of work with ozone in intra-articular joint injections, particularly for helping the body start rebuilding the cartilage in the joint, and we do that for pain relief, for back pain as an example. I'm a perfect example of that. I have my own herniated discs, and I get this treatment on a fairly regular basis to help me stay free of pain. So I don't have to use pain medications. The world is withdrawing opioids from most people now, and they don't have a recourse. So this is a wonderful recourse for people who are in pain. It does relieve the inflammation and resets the signals so that pain isn't being felt anymore, as an example. Now, ultraviolet blood irradiation therapy also creates ozone in blood, so when you treat blood with ultraviolet light, it acts differently than it does on the skin. And it starts driving all sorts of immune system reactions that are able to help the patient decrease pain levels, increase energy levels, get cellular structures working the way they should, reestablishing pH, reestablishing the electrical conductivities of the cells, the oxygen and the water within the cell. I put an IV catheter cannula, attached a sterile line to it that had a little bit of heparin. And then that piece that was glass was placed in a little box, which is called a UV light box. And that line was attached to me on the other end that had 30 cc's of ozone in it, medical ozone at a specific concentration. And so because she only weighed 100 pounds, I could only treat 150 cc's of her blood, mixing it with the ozone and the oxygen each time it came to me in the syringe. Then after the end of that, I had to push it all back and then pull the IV line and compress that area so that she didn't have a big hematoma afterwards. So that's what does the magic.